Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Pigeon Pose. Pigeon Pose uses and works on both spinal extension and hip faber, flexion, abduction, and external rotation. A unique combination. This pose is complex, so check with your therapist or doctor about customizing the pose to your needs before practicing this video. Medical Therapeutic Yoga also reviews many modifications. Let's begin. This pose has a unique blanket fold. 2 tri-fold blankets, as you see here, which may also require the use of 2 blocks. Arrange the blankets as shown here. Note that you can also take the edge of the outside tri-fold and fold it over again to help support and fill the space under the hip. Or you can add a block. For those with difficulty in the thoracic, the mid-spine, or the hip flexor region, you may need to build up the support higher. There's your options for building the support. For those with femoral version or dysplasia issues in the hip, this pose will require specific therapist-adapted prescription. Let's start by resting midway in the pose, not resting all the way down or pressing all the way up. Place the bent front knee on the outside edge of the mat. Allow the heel to rest near the groin. The lower leg bent knee never leaves the groin. This is incredibly important. The back leg rests in internal rotation of the hip over the back blanket. No blanket will be under the back kneecap or patella. This is important to protect the knee and the front of the hip, as well as properly support the sacroiliac joint. You can try resting down at this point, but there should be no hip or SI joint pain. Place blocks under the forearms or the hands to help press up when you're ready. The final manifestation of this pose is to play with flexing the back knee. It should not create any hip or SI joint pain. Flexing the knee also should not cause a large lifting of the pelvis off of the blanket. This means, other than knee flexion, the lower body should be at ease and not firing. Remember to use arm spiral here as I'm demonstrating to support the upper body when you do press up. To come out of the pose, simply bring the leg around slowly and mindfully. Let's repeat on the opposite side. You'll need to change your blanket configuration. The highest point of the V that the blanket is creating will be close to the outer edge of the mat where the knee goes. As I'm outlining, right knee on the outer edge of the mat and heel toward the groin, which fits perfectly up to the blanket, so the tibia is in line with the outer blanket. Make sure that the patella clears the back blanket, the kneecap is not pressing into the blanket. And you can rest down to begin if you prefer. You can always stay midway in the pose, neither resting all the way down or pressing all the way up. If you do choose to press up, start with using blocks. Blocks under the forearms. using a strong arm spiral, so that means the palms will turn up and the shoulders will move away from the ears, strengthening the muscles around the scapula. With time, you can press up, keeping the pelvis symmetrical and supporting the pose with a mild DATD breath. Checking alignment of the pelvis to make sure it's symmetrical, that the SI joint is not torquing or twisting at all. And finally, when you're ready, you could play with flexing the back knee. The breath should be full and unobstructed by the pose. Pigeon has many therapeutic benefits, which you can read about in Medical Therapeutic Yoga. Thank you for joining me.